Good morning, Dr. Ann.
Sorry, good morning.
Good morning. Well, you said it wasn't over, and it looks like you're right.
Well, I was here, I just looked at my calendar. I was here 6 weeks ago. That was the last time I was on. And at that time, we were looking at the uptick in military cases, and it was right after that we were watching that, and then also the civilian cases, and now we're in a full-blown surge, and it's still a pandemic. So, yeah, unfortunately. People keep talking about the breakthrough cases. Since we started vaccinating, the total number of fully vaccinated people who have turned positive is about 16%. That's a little higher in the past couple of weeks. It's about 20-something percent. So the vast majority of cases are still among the unvaccinated. You just heard from Lillian Posadas, GMH. Almost everybody at the hospital who's in there is unvaccinated. So that's why we're pushing vaccinations still. There's only two ways to go about this. It's either more restrictions or get everybody vaccinated and then continue the masking and the social distancing. That's where we are right now.
Doc, it kind of seems like it's like there's two races being run right now. One is like we got to vaccinate everybody to stave off the hospitalizations, but then the other is like how do we throw water on the numbers which are rising every single day?
It might mean more restricting large gatherings. I don't know. I think the governor it was on the news this morning that she's thinking about that. And of course now there's the mandates, whatever. But that's all we have for respiratory viruses. Masking, social distance, vaccine, these nasty viruses. That's the only thing, that's our only tool is vaccination. And even there, it's not 100%, as you can see. But that's just what happens.
Yeah. Let's talk community spread. So they're saying that these are all coming from community spread. Is that accurate?
It's mostly household transmission and then workplace transmission. We're seeing less military cases than we were before. It's now in the local community, so household transmission, also large gatherings, and some school clusters.
Can we go into the school? What do you mean school clusters? Because we've been told there's no clusters in the school and that it's all just unrelated.
Well, it depends on how you define cluster.
Yeah. Well, you're the expert, Doc.
The majority of what we're seeing is household transmission, and some with the school, and some workplace. But the majority is household transmission, local cases. Lots of families, as Lillian just mentioned, a family going into the ER, everybody was sick. We're seeing a lot of that.
So what do you mean about the school clusters?
I don't have any details on that. I was just told yesterday, yes, that somebody was saying, oh, there's no more clusters. It's actually, that was Dr. Manglonia. She's saying it's everywhere now. It's like, there's no clusters. It's like, no, we're still seeing clustered cases where people are, connected in time and place. I don't have the details. We're still pulling together data. The data I have is just from the sit rep, and the more detailed data we're still compiling for this week.
Right. And so I want to key in on what you said where, and I'm assuming you're talking about Dr. Jana Maglotnia. Tell her we said hi. We miss her.
Okay.
But you said it's everywhere, right? Dr. Maglotnia says it's everywhere. So, I mean, it is everywhere. If it's in the community, it's so widespread. Of course, there's going to be that spillover that happens at the school setting. We had 15 cases reported yesterday, and we asked this of the superintendent, at what point does the trigger happen where we say, okay, it's everywhere, it's spilling out into the schools, we've got 69 school cases, we got to do something?
Well, it really depends. And depending on what happens with the increase in vaccinations and this new mandate and the possibility of restriction, in 2 weeks we could see the numbers go down. If people, continue to, it's all about the community and their response and their behavior. So it's about community responsibility. Public health is community health. We have to rely on the community to do what they're supposed to do for all of us. It's a collective responsibility. It's not just an individual responsibility.
Right, but right now the community is allowed to do a lot of things that are contributing to the spread of this virus because I mean, we're starting to see the businesses come out and say, "Hey, give us 50% occupancy. Let's get a handle on this thing." So the government response is lagging a little bit behind, it seems.
Well, I don't know that. I don't see why if you have a business you couldn't do that anyway.
Right. Yeah. Yeah. And some are. I
Private
mean,
business, they can do what they want. They can restrict. They can have only 2 people, per 20 feet if they want.
yeah. I kind of want to go back to the schools because just in talking like with the school level staff, we just hear a lot of things like the texting with a teacher. We have 1 nurse for 880 face-to-face students. She has to track meds, TB clearance, contact tracing on top of falls, headaches, lice. Social distancing of 880 kids is unreasonable.
Well, and that's an issue that has been going on for 40 years, the underfunding of public health. It started with Reaganomics, and now you see why we've had to hire people temporarily to deal with this pandemic, because we didn't have the capacity to deal with it. And this is not just Guam, this is Hawaii, this is nationally. Public health has been underfunded for decades. So we're now seeing all this money, and they're trying to throw money at the problem, so we're hiring people. And yes, we need more nurses. On the news last night, national news, there's a shortage of nurses nationwide. We need 1 million more nurses in the U.S. How many do we need here? You probably need 1 nurse per, 300 students? I really don't know what the ratio is, but certainly we do need more nurses in the schools and within public health.
Yeah. Do we need more contact tracers? Because there's so many new cases. I mean,
Yeah.
I'm not sure how many are all connected, but do you know how
Our
things are
contact
going?
tracers are doing a really good job. We actually also have 2 people just at the lab to call people with results.
Yeah, we're
And
hearing a
they're
lot
also
about
going to be
the.
hiring community health workers with some new grant money.
I
as
mean,
well.
it's interesting, Doc, because we hear from, like Chima and public health that they're on top of the contact tracing, that they're on top of reporting the results. But then when we speak to the public, it's a lot of times it's the opposite. We're hearing people, they wait in days for the results. We're hearing about people who are, close contacts not getting called in, I guess, what they feel is a timely manner. So, I mean, it kind of just makes sense to me with this high number of positives. Like, of course, public health is going to be overwhelmed.
Right. And if the need arises, they're going to bring people back from work. But again, we're all stretched thin. I don't know if you saw the lines just for the testing
Yeah.
last week. I mean, it went all the way from the entrance at the carnival grounds at Teeds and all the way to, it was like 2 miles long. So, yes.
But that's the
Public
interesting
health is
thing.
doing the best we can with the resources that we have.
Yeah, but that's the interesting thing. The lines are all the way down to Umatic, and yet why don't we have another testing facility open since like yesterday?
I'm not in charge of operations.
Yeah,
You
I
have
know.
to get someone else to talk about the operations and the testing. I mean, there's different components to all of this.
Yeah, it just seems
So
like
you have to get,
it would make sense, especially if we're mandating everybody, get vaccinated.
Doc, let me ask you this. So you said it's the community, right? The community has to do something. So what does the community have to do?
the people who aren't vaccinated need to get vaccinated if they aren't allergic to it or whatever. That's what we need to do. We need to be at 90 or 100% or 99.9. We'll never get 100%, but we need to get almost 100% vaccinations. So people who aren't vaccinated need to get vaccinated. We've seen the biggest group, even though we've seen during this surge an uptick in all age groups, the biggest group is the 18 to 39 group. Even though we're also seeing uptick in, children and et cetera. That's the majority of cases. And there's a lot of people in that group who think they're immune, or they read something on the internet, they don't want to get the vaccine. It's part of your community responsibility to get vaccinated. It's FDA approved now. Nobody's a guinea pig anymore. Of course, we're all guinea pigs technically, but that's the best thing. Get vaccinated and then follow whatever restrictions. It's not over. It might not be over for a while. And look, we're in the middle of a surge again, and everybody here is also sick of it, but we have to deal with it. So we're working as usual overtime.
I think I still have the clip somewhere on my Instagram of you and Dr. Jana talking about this, last year. It's going to be 2 years.
Or more.
Yeah, we're in the second year of
Yeah.
this.
Doc, can you
This
kind
is
of...
already a year and a half.
Yeah.
It's been a year and a half.
So we
And I know everybody's sick of it, but it's a pandemic. It's worldwide. It's not ending anytime soon. So we still have to do what we can, and the vaccination is the best way. So it is preventing deaths, even though we've seen all of the deaths since we started vaccinating. There was only one that had a vaccination,
Right.
Johnson & Johnson. All the rest were unvaccinated. Those are preventable deaths, especially elderly people with comorbid conditions. All of the deaths, almost all have comorbid conditions, and they're usually older,
do we need
middle-aged or elderly.
do we need to do anything, Doc, to mitigate the rising number of positive cases, or do you think that that's not as important as getting everyone vaccinated?
It's both. Have to do both. And I don't make those calls. That's the governor's job. Hafa.
We just don't want to get anyone else in
But
trouble.
come on.
We don't want to read about Dr. Ann resigned on Friday because she was on the link on a Monday. Don't want it.
No, please,
All
no.
right,
We love
yeah.
Dr. Ann.
Anything else, Bree?
Go get vaccinated if you haven't already.
But okay.
Yeah.
Do you have any data to show out of for example the 147 yesterday, how many were positives? I mean, how many were vaccinated and how many were unvaccinated? We keep getting this question.
Yesterday, I don't know. There was 147 cases. The day before that, there was 126 cases, and 26 were vaccinated. So 21%.
Okay.
That's about right. That's about what we're seeing.
Yeah.
And almost 150 cases yesterday. I mean, Hawaii's getting thousands of cases a day. 150 for us is too much.
Yeah.
And they're going through a massive surge, and they're overwhelmed as well. And we just, I don't want to see it. But we're dealing with it.
We had a
But we
doctor.
still need people to get vaccinated and just follow the rules. And don't plan a giant wedding or anything like that. It's still a pandemic. I know people have to get married and babies have to be born and all this stuff, but maybe you should wait.
Yeah. Hey, if it's great, it can wait, guys. If it's true love, it can wait.
No true love waits.
I saw it in a movie. Oh, darn. Whoops.
Ooh.
All right,
That
Dr.
hurt,
Ann.
didn't it?
So there you go. Don't get married, guys. You heard it right here on the link. Breaking news.
Okay, adios.
Yeah, right
Thanks,
on. Thank you,
Doc.
Have
Doc.
a good one, Doc.
Okay.
Yes,
Take
that.
care.
Right on. They don't want to see it. You heard her. She said, I don't want to see it here. Dr. Hoa says it's going to get worse. Hospitalizations, positives are going to continue to rise.
I like Dr. Ann because she always speaks from a standpoint of logic, and she
Yeah.
goes, it's just, it's just easy. If you haven't got the shot, get the shot if you can. And then wear your mask, stay apart, don't do anything,
Don't go out and have big weddings.
don't
Yeah.
do anything unconscionable.
I mean,
Social
but-
gatherings, limit it.
Yeah. She's saying we got to do both. We got to get vaccinated and we got to do everything to control the spread of the virus, which is rampant. Rampant. It's 9:36. Let's take a break, guys. I need to decompress, man. This is starting to get to me. Is it getting to you again?